My name is Nick Johnston, and today I want to talk about Lyme disease and everything you need to know to protect yourself and your family from this very dangerous and widespread disease. So, for starters, here's what we're going to be talking about with this presentation today. First of all, a brief history of Lyme disease, how it's spread, where it's found, how it's diagnosed, how it's treated, how it's prevented, and finally, what's next with Lyme disease as we look ahead to the future. So for starters, I want to start off with this lovely photo here. Nice. Oh, this girl's enjoying a beautiful sunny day here. Doesn't look like she has a care in the world. But unfortunately, if we look a little bit closer, oh, dear Lord, her scalp is infested with dozens of Lyme disease carrying ticks. Ugh. Let that image sink in a little bit. Yikes. So, how did we get here? Let's talk a little bit about the history of Lyme disease because as a child of the 80s, we didn't have to talk much about Lyme disease when I was growing up. I could roll around in a pile full of leaves to my heart's content and not worry about getting Lyme disease, or at least not worry nearly as much as we have to today. So where did Lyme disease come from? Well, first of all, interestingly enough, ticks and Lyme disease have been around for thousands of years. In fact, a recent autopsy of a 5,300-year-old mummy indicated the presence of the bacteria that cause Lyme disease. So this is not a recent phenomenon. Lyme disease, however, was only recognized in the United States in the 60s and 70s, and really only the mid-70s. And the bacteria that causes Lyme disease wasn't officially classified until 1981, 1 year before I was born. So here's what happened. In the early 1970s, a group of children and adults in Lyme, Connecticut, and yes, that's where it got its name, they were suffering from some puzzling and debilitating health issues. Symptoms included swollen knees, paralysis, skin rashes, headaches, and severe chronic fatigue. But for years during the 60s and 70s, the families were left undiagnosed and untreated, or maybe more to the point, misdiagnosed. And that's one of the problems with Lyme disease, is that some of the symptoms, could look like an allergic reaction, or can mask themselves as perhaps a different type of disease or illness. But knowing something was seriously wrong, two mothers from this group began to do some research on their own, taking notes, and contacting scientists. In fact, if it wasn't for the persistence of those two mothers, Lyme disease might still be little known even today. Again, it went on for thousands of years without being fully understood. But thanks to that persistence, we now know a lot more about it. Scientists in the mid-70s began to describe the signs and symptoms of this new disease. They called it Lyme, but they still didn't know exactly what was causing this strange disease. Finally, in 1981, enter a scientist named Willy Bergdorfer, who began to study Lyme disease. He had been studying other tick-borne illnesses, so he was the right man for the job. And in 1981, he classified the bacterium called spirochetes carried by ticks, and that is what was causing Lyme disease. Since the 1980s, reports of Lyme disease have increased dramatically. Check out this chart. This shows, in black, those are the actual reports of Lyme disease to the CDC. But in green, that's the more accurate, that's the represented estimate of the total number of Lyme disease cases nationwide. And yeah, at the very beginning here, that was 1982, where there were barely any reports of Lyme disease. And now, into the late, that's last bar is from 2012, and we're talking about 300,000 cases nationwide. So a rapidly increasing vector disease. Today, Lyme disease is one of the fastest growing vector-borne illnesses in the United States. The CDC estimates that there are over 300,000 new cases of Lyme disease each year in the U.S. So how is Lyme disease spread? It started in Lyme, Connecticut, and just sort of went out in all directions. Well, Lyme disease bacteria, Borrelia burgdorferi, named after the scientist who discovered it, is spread through the bite of infected ticks, and pretty much only through the bite of infected ticks. Ticks can attach themselves to any part of the human body, but are often found in hard-to-see areas such as the groin, armpits, and scalp. In general, ticks need to be attached for 36 to 48 hours before they can transmit the Lyme disease bacteria. Now, there is some good news. It's not instantaneous. If you do get bitten by a tick, you have at least usually 24 hours to get that tick off of you before it's able to transmit the bacteria. So it's not instantaneous. So there's some good news with this disease. Specifically, not all ticks carry Lyme disease. It is the black-legged tick or deer tick, this ugly bugger, who carries Lyme disease and spreads the disease to humans. Now, what you just saw there was the tick in adult stage. But here's the life cycle of ticks. The eggs are laid in the spring, and by summer they turn into larvae. Now, those larvae don't really threaten humans, but they can start attaching to mice and birds and get spread. Then those larvae make it through the winter, and by the next spring they've turned into nymphs. Now, nymphs do threaten humans. They also threaten things like squirrels, foxes, deer. Most mammals, in fact, that are out in the woods are then at risk of being bitten by nymphs. They feed through the summer, and by the fall they turn into adult ticks, and after another winter season they lay their eggs in spring, and the whole cycle repeats. Now, most humans that are infected through the bites of those immature ticks called nymphs. Those nymphs are tiny. We're talking about less than 2 millimeters in diameter, really small and difficult to see. They feed during the spring and summer months, and that's when they're most likely to attach to you or me and infect us with Lyme disease. Adult ticks can also transmit Lyme disease bacteria, but because the adults are significantly larger, they're more likely to be spotted and removed before they're able to transmit the disease. So that's why it's typically the nymphs that are so tiny that are able to actually infect us. Now, let me get out of the way and show you this. These are the different stages of tick development. Again, the nymph that I've circled there is the most likely threat to humans. Now, check out the size of those ticks compared to a dime. The D in dime is about the size of a nymph tick. So we're talking crazy tiny. And that's why they're so hard to spot. Now, ticks search for host animals from the leaf litter on the forest floor or from the tips of grasses and shrubs. Ticks crawl onto humans, animals, and people as they brush against them by walking past. Ticks cannot jump or fly. Now, that's something that, as a teenager, I was told that ticks can jump. They can't, at least not the deer tick. And they don't jump out of treetops either. In fact, if a tick found on the scalp, in the hairline, has usually crawled there from the lower part of the body. Again, often they're in the leaf litter on the ground, so they get onto your boots and they crawl up your pant leg, and eventually they find themselves in armpits or in the scalp. Now, I wanted to mention this, how Lyme disease is not spread, because I think that's important too. First of all, there is no evidence that Lyme disease is transmitted from person to person. So there's some good news. It is not possible, for example, for a person to get infected from touching, kissing, or having sexual intercourse with a person who has Lyme disease. Good news. And more good news. Although cats and dogs can and do get Lyme disease, there's no evidence that they are able to spread that disease directly to their owners. Good news there. However, of course, outdoor cats and dogs do pick up infected ticks and bring them into your home or yard. So strongly consider protecting your pet through the use of tick control products for animals like tick collars. There is also no report of Lyme disease being transmitted from breast milk from mother to child. However, Lyme disease acquired during pregnancy may lead to infection of the placenta and possible stillbirth. So it's a very serious disease if a pregnant mother happens to get Lyme disease. It can really threaten the child inside her. You will not get Lyme disease from eating venison or squirrel meat. Hey, there's some good news. So you can eat all the squirrel meat you want. But know this, you got to be careful when you're dressing the deer or squirrel meat because, again, infected ticks can live in the fur, and dressing those animals, hunting them, can bring you into close contact. So you can still get an infected tick on you, but the meat itself does not transfer the disease. You just want to make sure that you cook it properly. Now, where is Lyme disease prevalent? Well, here's some not great news if you live in the Northeast. Lyme disease has been reported in every state in the Union except Hawaii. And the reason for that is the black-legged tick does not live in Hawaii. No ticks, no Lyme disease. So Hawaii is exempt, but every other state in the Union has reported Lyme disease. However, while every state has reported it, more than 95% of all confirmed Lyme disease cases come from the following 14 states: Connecticut, Delaware, Maine, Maryland, Massachusetts, Minnesota, New Hampshire, New Jersey, New York, Pennsylvania, Rhode Island, Vermont, Virginia, and Wisconsin. And for you geography buffs, if you live in the upstate New York or New England area, that is pretty much ground zero. Here's the map. And that's what I mean. Look at the dense concentration. Yes, there are ticks found in Wisconsin and Minnesota, but look at the concentration of reports there in New York and the surrounding states. Not good. Not good at all. Now in New York, here's the breakdown. In black, the black shaded counties, those are the areas that have seen 500 or more reported cases of Lyme disease. And those include Saratoga, Rensselaer, that's Dutchess County there, also down into Orange, Putnam County, and in the Long Island area, that's Suffolk County, New York, where there have been more than 500 cases reported. Now, this map was from 2014, but it's still a good general rule of where the highest concentrations are found. Now, in Schenectady County, in red, those are counties where there's been between 50 and 100 cases reported. And in Albany County, that was between 100 and 300 cases, the blue shaded counties there. So yeah, it's generally eastern and southern New York where the highest concentrations of Lyme disease reports have been found. So what are the early symptoms of Lyme disease? Well, the erythema migrans, EM rash, occurs in about 70 to 80% of patients with Lyme disease. That is what you typically hear described as the bullseye rash that often develops. Often, but not always. And that's one of the problems. There's not any real guarantee when it comes to symptoms. Some people have different symptoms than other people. The EM rash expands slowly over a few days, which develops that bullseye appearance consisting of a red ring with central clearing. However, not everybody gets that. Again, that's only in about 70 to 80% of patients. And sometimes the rash can take on a different appearance. Sometimes it looks more like a solid lesion. It can look blue or purple hues. Sometimes there is crusted or blistering lesions that have all been documented. So the form of the rash can take different appearances. And again, not everybody even gets a rash to begin with. So that's one of the challenges in identifying the disease. And if early localized Lyme disease is not treated, patients may develop multiple secondary circular rashes as the spirochetes disseminate throughout the body. So here are the different types of rashes. Now the first two up here, those are more the typical type of that bullseye appearance. But there's also the red lesions over there. We've got these red kind of plaque areas on the trunk. They've got behind the knees where there can be kind of a bluish tint. And again, there's these multiple different spots that can develop with kind of dusky looking centers. So there's different forms that the rash can take on. Then there's also this. My father, for example, has gotten Lyme disease twice now, and neither time did he get a rash, but he did get a number of these symptoms: fever, chills, headache, fatigue, muscle and joint aches, and swollen lymph nodes. I don't think he had swollen lymph nodes, but he had pretty much all of those other symptoms. Nasty stuff. And severe headaches and stiffness can develop. If the disease is left untreated, as one might imagine, the symptoms do tend to get progressively worse. And interesting to note, the longer the disease is left untreated in the body, the harder it is to get rid of. So if left untreated, severe headaches and neck stiffness can develop. Additional EM rashes can develop on other parts of the body. Arthritis with severe joint pain and swelling, particularly in the knees and other large joints. Facial palsy, loss of muscle tone or droop on one or both sides of the face can develop. Intermittent pain in tendons, muscles, joints, and bones. Heart palpitations or an irregular heartbeat. Episodes of dizziness or shortness of breath. Inflammation of the brain and spinal cord. Nerve pain. Shooting pains, numbness or tingling of the hands or feet. And finally, problems with short-term memory. Lots of different symptoms. And again, if left untreated, some of these can persist. So what is the treatment for Lyme disease? Well, fortunately, that's a fairly simple answer. The treatment for Lyme disease, antibiotics. And people treated with appropriate antibiotics in the early stages of Lyme disease usually recover rapidly and completely within just a few weeks. Now that's usually recover rapidly and completely within a few weeks. Antibiotics commonly used for oral treatment include doxycycline and amoxicillin. But as I said, usually recover completely. In a small percentage of cases, about 10 to 20%, symptoms can persist even after being treated. And again, the longer the disease is inside you and left untreated before you realize it and get treated with antibiotics, the more likely you are to be in one of those 10 to 20% categories. This condition is known as post-treatment Lyme disease syndrome, PTLDS, although it is more oftenly called chronic Lyme disease. Now here's a look at a chart showing the rise in chronic Lyme disease, basically. And at this point, the CDC estimates that between 440,000 and 880 Americans continue to experience symptoms even after treatment. Now this map basically correlates to the number of nationwide cases. As the number of nationwide cases rise, so too do the number of chronic Lyme disease cases. Nasty stuff. So your best bet is to prevent Lyme disease from ever occurring. You don't want to have to treat it. You want to prevent it from ever happening. So how do you prevent it? Well, first of all, the first step is to avoid tick-infested locations, such as wooded areas with a lot of underbrush and fields with tall grass. But what if you like the outdoors? Like myself, you like to get out and do hiking and camping? Well, then avoiding tick-infested locations is not a possibility. So if you're one of those type of people, you want to try to walk in the center of trails to avoid contact with overgrown grass, brush, and leaf litter at the trail edges. And you want to be extra vigilant in the warmer months. Now here's a chart that shows when people are most commonly infected. And notice it's May, June, July, August, and into September. Now, you still can get infected ticks in the other months. The numbers are just a lot lower. In fact, my mom was snowshoeing once in January, and she did get not Lyme disease, but she got a tick on her. Fortunately, she noticed it and was able to dispose of the tick. But you can still get ticks in the winter months as well. But notice it's a lot more common that people get infected during the warmer summer months. That's for two reasons. One, that's when ticks are more active, and two, that's when people are more commonly out in nature. So how do you prevent it? Well, aside from sticking to the center of trails, you can use bug repellent that contains 20% or more DEET, picaridin, or IR3535 on exposed skin. You can also treat your clothing and gear with permethrin. Again, you can treat your gear, clothing, boots, pants, socks, and tents with products containing 0.5% permethrin. Though you want to follow all precautions. With that, you want to spray down the, say, your pants. You want to spray it down real well, but then you want to let it dry in a well-ventilated area before putting it back on. Permethrin is not supposed to come in contact with exposed skin, and it can also be dangerous for house pets. So make sure you're reading all of the warning labels. You want to wear light-colored clothing. Now, the reason for that is so that you're more easily able to spot the ticks. Remember, they're tiny. A small moving dot is a lot easier to spot on light-colored clothing than it would be on, say, a dark sweatshirt. So that's the reason you want to wear light-colored clothing. Wear long-sleeved shirts and pants. And with pants, you want to make sure that you're tucking your pants into your boots. Doesn't help you to wear long pants if they're not tucked in, because a tick could just get on your boot and crawl up underneath your pant leg, and it defeats the whole purpose. Another way to prevent Lyme disease: bathe or shower as soon as possible after coming indoors, preferably within 2 hours of coming indoors, to wash off and more easily find ticks that are crawling on you. And I've had that experience. I found a tick once in the shower. So that is a good method. Also, you want to conduct a full-body tick check using a handheld or full-length mirror to view all parts of your body upon return from tick-infested areas. Parents, you should be checking your children regularly. If they're outside a lot, daily, during especially the warmer summer months. You want to check for ticks under the arms, in and around the ears, inside the belly button, behind the knees, between the legs, around the waist, and especially in the hairline. That's tough for even adults. In the hairline, once they get in there, it is tough to spot them. There's one other method. You could ask Brad Paisley to help. He loves checking for ticks. He even wrote a song about that. Now, for those who aren't familiar, you can look that up on YouTube, but the line from the song goes, I'm not going to sing it. My singing is also a cause of Lyme disease, so we're going to avoid that. But let me try with a little bit of a southern accent here. 'Cause I'd like to see you out in the moonlight. I'd like to kiss you way back in the sticks. I'd like to walk you through a field of wildflowers. And I'd like to check you for ticks. It's a lot prettier when Brad sings it, but that's the gist. So there's that. But more seriously, yeah, so examine your gear and, of course, your pets. Ticks can ride into the home on clothing and pets, then attach to a person later, and they survive without a host for an incredibly long amount of time. Months, ticks can survive without a host. So you really got to find them and kill them. They can get into the home and attach to a person later, so carefully examine pets' coats and day packs. Now, here's a good method of getting rid of ticks in your clothing or packs. If you can, throw them in the dryer for at least 10 minutes. Enough heat will kill ticks. Now, if your clothing is damp or if they need to be washed, additional time is going to be needed. Your best bet is to wash it with hot water if you can. If not, just make sure they are fully hot and dry. Otherwise, you want to clear your yard. You want to try to limit tick populations on your property. And one method for that is, clear your yard. Ticks need damp and shade to stay alive. So clear your yard of leaf litter and shady hiding places and keep your grass mowed short, Nick Johnston. I didn't say it was easy, but that's a good method of keeping the tick populations down, is mowing frequently and raking up all of the leaf litter. Also, rodents and deer can transport ticks, so keep the rodents away by tightly covering all your trash and use a fence or deer repellent to keep the deer away. Now, my parents have tried using deer repellents without a whole lot of success. Your best bet is to put up a deer fence, but that's, not easy or cheap. And unfortunately, deer repellents are not always all that effective. Another way to limit tick populations on your property: create a barrier like this. If your yard is next to the woods, create a 3-foot wide border using dry mulch or gravel. This prevents plant growth and makes it much harder for ticks to enter your yard. The idea is, remember, they need damp shade. So if you create this almost like you can think of it like a mini desert, It makes it very hard for the ticks to actually cross that 3-foot border. So that's a good method of limiting their entrance into your yard. Now, if you do happen to get bitten by a tick and you find a tick on you, obviously you want to try to get that tick off as soon as possible. But you want to try to use a fine-tipped tweezer to grab the tick as close to the skin as possible. Here's something interesting. You want to use fine-tipped tweezers, not a broad-tipped tweezer. And the reason for that is, if you were to, say, grab the tick by the body and squeeze, it could actually inject some of the bacteria into you. So you don't want to do that. You want to grab the tick as close to the skin right by the head, and you want to slowly, steadily pull it away. Don't jerk it or twist it, then you're more likely to leave pieces of the tick inside you. Now, you also want to remember to clean the bite area and your hands with rubbing alcohol or soap and water. Wash everything thoroughly. That'll help reduce the risk of infection. And if there are little bits of the tick left in your arm or wherever it is, don't try digging it out. Just clean the area thoroughly and let your skin do its thing. Normally, the pieces of tick will fall out in a few days or a week or so on their own. You don't want to go digging around in your skin. So what do you do if you do find a tick? How do you kill it? Well, one of the best methods is to wrap the tick tightly in, say, tape, like packing tape, clear tape. Cover the tick with transparent tape on all sides. The tick will die on its own, hopefully painfully, and it cannot get free. There's another purpose to this. It preserves the tick so that if you do start showing symptoms, you can bring that tick in and show it to a doctor, and they can help identify the tick, and theoretically they could maybe test the tick as well. The other methods are to drop that tick into a container full of rubbing alcohol, but it may take a while for that tick to die. They are notoriously hard to kill. So you want to cover that rubbing alcohol with a transparent lid to make sure it doesn't escape. If you don't have rubbing alcohol, bleach works great, or vinegar. Boiling water will also work, and I can say this. I once found a tick on me when I was barbecuing, and I can say this. If you squirt that tick with lighter fluid and light it on fire, fire also will kill a tick. I can confirm this, but it is not the recommended method of disposal. So what's next? Well, we want to try to increase public awareness and funding. Public funding for Lyme disease is surprisingly far behind, below that of less common illnesses. For example, Lyme disease receives less than 2% of the public funding for West Nile and 0.2% of the funding for HIV and AIDS, despite the fact that the annual case count for Lyme disease dwarfs that of either of those other two. Now, again, that's not to say that they're not obviously very serious. West Nile and HIV/AIDS, very serious diseases, but in terms of the numbers, Lyme disease affects dramatically more people and yet receives dramatically less funding. So that's the problem, is that disparity there. I'm not sure if you can read this chart very well, so I'll read it out for you. Malaria only has about 1,500 to 2,000 cases in the United States, but per patient per year, each patient gets about $73,000 worth of funding. Compare that to, say, Lyme disease, which has over 300,000 cases in the United States each year, and per person per year, only about $133 per person, compared to, say, for, again, malaria, which gets $73,000 per person. So it's a big difference, and that's not a good thing. So what's next? Well, here's something. Keep an eye out for tick-killing robots. Why not? It's 2018, right? Well, as of March 2015, a Delaware company is raising money to test the next stage of a tick-slaying robot. The idea being that the ticks are drawn, tricked into latching onto the robot and drinking pesticides. It's not yet on the market, at least not at the time of this report. I checked the internet. Can't buy one yet, but presumably they're coming soon. But more realistically, what really is coming next is a vaccine. A vaccine would be great. Everybody could get a vaccine, and then you wouldn't have to worry about, I mean, there's other, well, Okay, I should back that up. You would still have to worry about tick bites because there's a lot of other diseases that are spread by ticks. I'm just talking about Lyme disease for today, but there's other diseases spread by ticks, so you'd still want to watch out for tick bites, but this would be a huge step. Now, developing a vaccine, again, why do I say that? Well, because back in 1998, a vaccine called Lymerix was approved by the FDA on December 21st. Lymerix was great stuff. It was shown to provide protection in 76% of adults and 100% of children, so why are we still talking about Lyme disease? Well, the reason was hundreds of vaccine recipients reported they had developed autoimmune and other side effects. Now, those claims were investigated by the FDA and the CDC, which found no connection between the vaccine and the autoimmune complaints. But despite that lack of evidence that the complaints were caused by the vaccine, sales plummeted due to negative media and all of these reports. And in February 2002, after only 4 years on the market, Lymerix was pulled from the U.S. and is no longer available. But there's good news. As of July 2017, a new vaccine called VLA15 was granted fast-track designation by the FDA, which will allow further study and will hopefully be rushed to market. So that's something to look forward to. So, quick recap. Lyme disease was discovered in Lyme, Connecticut, and the bacteria responsible was first identified in 1981. Since the 70s and 80s, it has spread rapidly, becoming one of the fastest-growing vector-borne infections in the United States. The CDC estimates that there are currently over 300,000 new cases each year. The best way to prevent Lyme disease is to limit tick populations, avoid tick-prone areas, use bug repellents, and do thorough tick checks. If infection occurs, immediate antibiotics are usually effective. And moving forward, we want to try to increase public awareness and funding and develop a vaccine for Lyme disease. All right. So here are the sources I used for this report: the Center for Disease Control and Prevention, the Bay Area Lyme Foundation, Wikipedia, and WikiHow. Thanks very much for watching.